Okay, good morning to all of you. Good morning, very good morning. So, in previous class, we have discussed about epidemiology of tuberculosis. We have discussed about incidence, prevalence. We have discussed about global situation in India. What are the symptoms of tuberculosis? Then, what are the factors, positive factors of tuberculosis? Now today we are going to discuss about prevention and control of tuberculosis. Ask your colleague that our class has been started and your attendance is regularly being sent. I will ask at any point of time to write down your roll number in your chat box. Not now, I will ask at any time during our class. So your attendance will be marked and it will be sent regularly to your class coordinator as well as your college. So ask to attend the class. Okay, write down what are the factors, what are the positive factors for tuberculosis. Write down in chat box what are the factors which lead to tuberculosis. So very good morning to all of you who are entering now, just now. Write down what are the factors behind tuberculosis which led to tuberculosis. Write down the name of the causative agent as well as what are the factors which lead to tuberculosis. We have discussed previously. As I am getting answer, Mycobacterium tuberculosis, it is the causative organism of TB. What are the factors? What are the factors behind tuberculosis? Mycobacterium tuberculosis, yes, I am getting answer. Low socioeconomic class, then impaired immunity, malnutrition, very nice. Okay. Any other factors? So all of you are writing positive agent of tuberculosis. Yes, another smoker, traveler, diabetes, HIV, silicosis, migraines, very nice. Okay, what are the symptoms of tuberculosis? Symptoms. Write down symptoms of tuberculosis. Still only 26 students are online. Ask your colleague to join the class as your attendance is being regularly sent. Your attendance is being regularly sent. I will ask any part of time to write down your roll number in chat box also. That is the dual method of attendance. So write down the symptoms of tuberculosis. What are the symptoms of tuberculosis? Write down in chat box about symptoms of tuberculosis. Yes, I am getting answer. Cough, yellow mostly. It may not be necessary that it is yellow. It may be white also. Cough for more than 2 weeks, fever, yes. Then loss of appetite, cough, loss of appetite, fever. Do not write roll number or name now. I will ask at any point of time during our class. Loss of appetite, fever. Okay, very good. So cough for more than 2 weeks. Then it may be productive cough. There can be, along with the cough, there can be hemoptysis, means blood in sputum. Hemoptysis is blood in sputum. There can be fever. It may be evening rise fever, loss of weight. So these are the symptoms of tuberculosis. Fatigue, yes, chest pain, chronic cough. So we will discuss prevention and control of tuberculosis now. We select the pointer. So TB control is reduction. What do you mean by TB control? It is reduction in incidence and prevalence of disease in community. If we reduce the incidence is number of new cases. Remember this, we have discussed in general epidemiology also. Incidence is number of new cases of any disease. Prevalence is number of new plus old cases of disease in community. If we reduce the incidence and prevalence of the disease in community, it may be considered as the control. So WHO defines TB control. When will we call TB has been controlled? WHO defines TB control as the reduction in the prevalence of natural infection in age group of 0 to 14 years to 1%. Whenever the prevalence in this age group 0 to 14 years is 1%, then we can call that the control of the TB has been achieved. So that is the definition given by WHO. So what are the steps for prevention of the tuberculosis? So any prevention can be classified into 3 types: primary prevention, secondary prevention, and tertiary prevention. So primary prevention is prevention of the disease before emergence of the risk factors. So that is called primary prevention. Secondary prevention is early diagnosis and treatment, and tertiary prevention include disability limitation, and rehabilitation. Again, in primary prevention, it includes the steps like health promotion. By promoting our health, by improving our nutrition, by increasing exercise, these are the ways of health promotion, right? So having the good diet, having good exercise, yoga, relaxation technique. In general, I am talking about this health promotion. So in case of the tuberculosis, improvement of the nutrition, it is considered as health promotion. Then specific protection means protection specific by giving some vaccine, by specifically protecting against the disease, means giving BCG vaccine. Write down the full form of BCG. I have asked previously also in chat box. Write down full form of BCG in chat box. So specific protection by giving BCG vaccine means BCG vaccine gives protection against tuberculosis only. So that is specific protection. And chemoprophylaxis means giving the drugs to the context of the person who is suffering from tuberculosis. Means any person in the household is having tuberculosis. If you give to the vulnerable contact, means children, the drugs like isoniazid, that is the chemoprophylaxis. So by giving the prophylaxis means giving the drugs to prevent tuberculosis to the context of the patient is chemoprophylaxis. So there are 2 things in primary prevention: health promotion, and specific protection includes vaccination and chemoprophylaxis. In secondary prevention, early diagnosis means whenever the patient comes with the symptom, we diagnose at the early stage so that we can prevent complication. And by giving the treatment, that is DOTS. So another short form is there. How many have you written? Okay, Bacillus calmatic urine. I have got the answers of so many students. Bacillus calmatic urine. Very nice. Okay. What is full form of DOTS? Write down the full form of DOTS in chat box. So secondary prevention include early diagnosis and treatment, DOTS, but nowadays it is 99 DOTS. I have explained you previously also, and today we are also going to discuss this 99 DOTS. Write down the full form of DOTS. And tertiary prevention include disability limitation. So whenever the disease has progress to the advanced stage, in that stage there will be tertiary prevention. So in this stage our efforts will be to prevent the disability and to give rehabilitation, means to person should be given the rehabilitation in form of vocational rehabilitation, medical rehabilitation. For example, giving job to the person who is deceased, that will be vocational rehabilitation. So that disease should not harm the community. So we can give the job to the person who is suffering from the disease, but the disease should not harm to the community. That is vocational rehabilitation. So was giving some medical aids like giving the calipers, giving the stick, walking stick to the person, that is rehabilitation, example of rehabilitation. So how many of you have written the full form of DOT? Okay, it is directly observed treatment strategy. Some of you have mistaken direct observed treatment, not that is that Direct observed therapy, no. Directly observed treatment strategy. Some of the students have written right. Okay, so first of all, health promotion. So I have given the example of health promotion, that is to give nutrition, improve nutrition intervention. The second point, nutritional intervention. So as we know that tuberculosis infection is prevalent in India among 40% of the people. 40% of the people, there are bacteria of the tuberculosis in their body, but everyone do not develop tuberculosis because their nutrition will be good, so that their immunity will be good, and ultimately disease will not develop. So by giving proper nutrition, protein rich nutrition, nutrition rich in macro and macronutrients, so that will be giving the immunity, that will boost up the immunity, and it will not allow the disease to develop. As you know that malnutrition is also prevalent in India. About 45% children in India are suffering from malnutrition. So to give the treatment of the malnutrition by giving the nutritional intervention, it will be leading to also decrease in incidence and prevalence of tuberculosis, and ultimately tuberculosis control. Environmental modification. So maintaining the hygiene, maintaining the sanitation of the environment, that is also one of the example of health promotion, best example of the health promotion. So sanitation, environmental sanitation, as you know that sanitation movement, Swachhta Abhiyan, has been started from 2014, and that is preventing so many infectious diseases, not only tuberculosis. So by maintaining this cleanliness, we are preventing so many infectious diseases. So that is also example of health promotion. Lifestyle and behavioral changes. For example, this cough etiquette, by coughing, behavioral changes. Nowadays, because of the corona, we have also learned these behavioral changes. Proper cough etiquette, we have learned that we do not cough in front of the others. We do not cough in front of the people who is standing just near to us. And we are keeping the handkerchief or side of our elbow while coughing. We should not keep our palm like this. We should keep the side of our elbow while coughing. And wearing the mask. So these are the behavioral changes. These are health. These are under this primary prevention. Lifestyle modification, using the mask, by making the social distance. Here in tuberculosis, all these principles also apply. And these principles of the prevention of corona, which also applies in case of the tuberculosis. The tuberculosis is very old disease. So this lifestyle and behavioral changes, what we are now acquiring today because of this COVID disease, and that also applies to this for tuberculosis. Health education, by educating the people about the disease, about the prevention and control methods. So these are also included in health promotion. This is the photograph of health education. So you can see the person keeping handkerchief over the mouth while coughing. So that is behavioral change. Then it includes also BCG specific protection, that is BCG vaccination. Not bacilli, we can say Bacillus calmette-guerin. So it is produced. So you in your exam, short note about the vaccines can be also asked. Different vaccines, whatever are used in our national immunization schedule. One of the basic vaccine is BCG. So you can learn from here about the BCG vaccination. So try to remember the things simultaneously. It is produced from Mycobacterium bovis. So, see, the causative organism for tuberculosis is Mycobacterium tuberculosis, but their other species, these are their brothers, Mycobacterium bovis. So it can be produced after 230 subcultures for 13 years. It takes very long time to produce. So aim of the vaccine is to induce benign artificial primary infection. In any type of the vaccine, by giving the vaccine, what we are giving either bacteria or virus, and so that we can induce the immunity, so that we can induce primary infection and we can produce immunity. So for the strain, remember the name of the strain recommended by WHO. It is Danish 1331 strain for vaccine production. The strain of the bacteria which is there in this vaccine is Danish 1331. So at what age it can be given? It can be given at as early as possible at birth. Soon after birth, as early as possible, BCG vaccine can be given. However, it can be also given up to 1 year. So it can be given at the 6 week along with the not deep nowadays not DPT is not used, pentavalent is used, pentavalent and OPV vaccine. So remember only this thing that it can be given at birth, but it can be given up to 1 year even. Wherever after 1 year it has no role. It's better to give at the birth. Protective value, it can protect child up to 15 to 20 years. So it is a vaccine which is protecting against childhood tuberculosis. So after 20 years, always there are chance of getting tuberculosis, and the protective value is up to 80%, 0 to 80%. It can protect. It can be giving the 0% protection or up to 80% protection. So it is variable. So better to take BCG vaccine than nothing to take. So you can remember the aim, the name of the strain, age, and protective value. So types of the vaccine: liquid vaccine and freeze-dried preparation available. We are using this liquid vaccine. BCG can be stored even for a year at temperature below 10 degrees centigrade. So normally the temperature range for storage of any vaccine is between 4 to 8 degrees centigrade. It is stored in the special type of the refrigerator that is known as ILR, that is Iceland refrigerator, and protected from exposure to light during storage. Reconstituted vaccine must be used within 3 hours. So what is the dose of the vaccine? It is 0.1 ml, 0.1 ml. Usual strength is 0.1 milligram in 0.1 ml. You can remember just 0.1 ml also. Usually, we are using whenever we are giving it vaccine at the birth. So 0.05 ml is the dose. If after 4 weeks, then it can be 0.1 ml. Administration, the route is intradermal. That is just below dermis. It is very tricky to give this vaccine. Just below dermis, this vaccine is given. So it should not go. The vaccine should not go into the muscles. Otherwise, it is not effective. So the needle is kept just parallel to the skin in newborn, and there will be intradermal administration over the insertion of the deltoid on the left side of the arm. Of the left side, it is universal that we have to give only on the left side of the arm or the insertion of the deltoid, and it will produce wheal of approximately 5 millimeter diameter afterwards. So that is the photograph of the BCG vaccine. You can see freeze-dried vaccine. It can be reconstituted with the help of the distilled water. And this is photograph of the intradermal, that just parallel to the skin, and you can papule formation over the skin. So it is of 10 doses. It is available as 5 doses also. So you can again see that formation of the papule. So phenomenon after vaccination, first of all, there can be papule formation. After some days, it will become nodule of the 4 to 8 millimeter diameter. So papule is the raised lesion, and it is containing fluid. Whenever the fluid will dry, it will form the nodule, that is hard formation. And this nodule will crust. It will crust and form the ulcer. It will burst and crusted ulcer will be formed, and there can be permanent scar of the vaccination. So it was considered previously that whenever the scar of the vaccination is present, then only it is effective. Previously, this concept was that, but since many years it has been changed that even if the scar is not produced, vaccine is considered to be effective. So it is not necessary that scar should be always produced after vaccination. So complication of the vaccine, local abscess formation here along with the papule, it can lead to abscess formation, local infection and abscess formation, and prolonged ulceration. This ulcer will dry up and it will form the permanent scar, but in some cases there can be prolonged ulceration at the site of the vaccination, suppurative lymphadenitis, and disseminated BCG infection and death. And so This is very rare. It is very rare. And nowadays, because of the improved technique and improved vaccine, this type of the complication along with BCG vaccine are not seen. Contraindication to which children it should not be given. Generally, any vaccine cannot be given to the immunocompromised child. Not only for this BCG vaccine, for any vaccine, remember that it cannot be given in case of the immunocompromised. So these are the points: immunodeficiency. In the conditions like HIV, leukemia, lymphoma, any child is suffering from HIV, leukemia, lymphoma, any vaccine cannot be given. So any child is receiving if immunosuppressive treatment, vaccine cannot be given. Apart from this, generalized eczema, infective dermatitis, hypogammaglobulinemia, and pregnancy, these are other contraindication for not giving the BCG vaccine. So that was about BCG vaccine. Chemoprophylaxis, that is the term used for preventive treatment, means giving the drug for prevention of the infection. So here the drug is used as INH, means isoniazid. INH is isoniazid. It can be used for 1 year, or isoniazid plus ethambutol combination for 9 months. So remember the name of the drug: isoniazid or isoniazid plus ethambutol. It can be costly, but it is available freely in government, and it is effective. Even though it is written that forget about this, it can be effective. So remember the name of the drug only. Now, diagnosis of tuberculosis. As you know, the symptoms of the tuberculosis. We have discussed about the symptoms of tuberculosis. So by these symptoms, if any person, TB is suspected in any patient, when the person is having the persistent cough, even though it is written 3 to 4 weeks, it is 2 weeks, more than 2 weeks. If any person is having the persistent cough for more than 2 week duration, we can suspect of having tuberculosis. Then continuous fever, chest pain, and hemoptysis. What is hemoptysis? Write down in chat box. What do you mean by hemoptysis? Write down in chat box. So for this symptom, patient may be suspected as of having tuberculosis. So there can be two definitions: case and suspect. Case is what? A patient whose sputum is positive for tuberculous bacilli. So many months we are hearing this word: the patient is positive, patient is positive. Here in case of this tuberculosis, sputum of the patient is positive. Sputum for AFB. AFB means acid-fast bacilli. This Mycobacterium tuberculosis are acid-fast bacilli. So if you suspect the person is having more than 2 week cough and other symptoms, and you ask for the sputum examination under microscope, that is sputum for AFB, acid-fast bacilli, and it comes positive that it shows the presence of tuberculous bacilli, then patient is considered as the case. And suspect sputum is negative, but who show the signs suggestive of the shadow in chest X-ray. This is chest X-ray, right? So suspected tuberculosis. How many of you have written the meaning of hemoptysis? Yes, blood in sputum. Very nice. Okay. So case finding tool for this. What are the investigation tools for diagnosis of the tuberculosis? Sputum examination, as I have already told, sputum for AFB, acid-fast bacilli. Mass miniature radiography. MMR, I have told previously about 3 to 4 MMR full forms. Among them, one of this is mass miniature radiography. It was previously used before about 20 years. Nowadays, it is not used. So remember sputum examination, tuberculin test, and this is also not to be remembered. Another test like CBNet. CBNet is there. I am going to show you the photograph of CBNet machine and explain you what is being done in CBNet. So remember this name, CBNet also. CBNAAT. So sputum examination and CBNet, these are two most important tools for diagnosis of the tuberculosis. So sputum examination, it includes sputum microscopy. Here 2 samples are to be collected, 2 samples of the sputum. Whenever any patient comes to you in your OPD with more than 2 week cough, you have to ask for this sputum microscopy. A laboratory technician will give 1 container So it container here patient have to give the sputum by cupping the sputum into the container at that time, and one container is to be taken at the home, and early morning next day he has to give the sputum sample in second container. So preferably early morning on second day, and one is at the time. If sputum is scanty, 24-hour sample can be collected also. If the sputum is not produced, laryngeal swabs or bronchial washing can be also collected. And this sputum is examined under the stain that is known as ZN stain, Ziehl-Neelsen stain. Remember this name of the stain. Or fluorescent microscopy can be also used, but most commonly we are using this Ziehl-Neelsen, ZN stain. So in ZN stain, number of bacilli in each smear is recorded, and it reflects number of bacilli reflect disease severity and patient infectivity. At least 2 smear must be examined, and both must be 1 or 2. Both can be positive. When you call positive, when you find the 1 to 9 bacilli per 100 oil immersion field, that is this sputum is examined under oil immersion lens. If you know that there are 3 lenses: low power, high power, and oil immersion. So under 100 oil immersion lens, if you find even 1 to 9 bacilli, then when patient can be considered as a sputum positive. You can see that here rod-shaped bacilli. These are the rod-shaped bacilli stained by pink stain by this ZN stain. You can find over here. These are the bacilli, rod-stained bacilli, rod-shaped. So for sputum smear to be positive, at least 1,000 organism must be present per ml of the sputum. It is present, then we can find 1 to 9 bacilli per 100 whole immersion field. So if you remember this content well, then it is okay, but it is the technique which is to be remembered by pathologist or microbiologist or this laboratory technician. But just you have to remember the name of the stain, as well as how many samples are collected and how does it look like. In severe immunocompromised, the sputum smear may be negative due to reduced inflammation of the lung. So if any patient is immunocompromised, sputum may be negative. Then also TB can be also present. That is diagnosed by CBNet. CBNet is having the high sensitivity. Sputum culture, it is also another method of diagnosis. Here the culture medium is LJ media. Remember this LJ medium, Lowenstein-Janssen medium. It is used for culture in clinical laboratory. So use of liquid media for radiometric growth. Another media, BACTEC, has also simplified the culture method. Remember this name, Lowenstein-Janssen medium, as well as BACTEC under the sputum culture. It is done only for the presenting with the chest symptom, but sputum is negative. So whenever the sputum is negative and the patient is having the symptoms of tuberculosis, this culture media, LJ media, as well as BACTEC can be used. It is not commonly used because it is difficult, tedious, lengthy, expensive, and need trained personnel. So culture of the sputum is necessary for carrying out sensitivity test as well as monitoring the drug treatment. Then mass miniature radiography, we are not going into the detail of this. Just remember the name of full form of the MMR. Mass miniature radiography is the miniature, means it is very small radiograph, just like the screen of the mobile. Just only it is having the size of the screen of the mobile, and it can be considered, it can be taken in the mass. So mass miniature radiography, previously it was there. Then tuberculin test. It is invalidated as the diagnostic tool. It is not used as a diagnostic tool. Just it can be used as the monitoring tool, monitoring of the treatment, because it has the error associated with the mode of administration and reading result. There can be lack of the specificity because of the high coverage of the BCG vaccine. Even if BCG vaccine is given, then tuberculin test may be positive. It can have the cross reaction with the other microbacteria also. So it is just used as a monitoring tool, not as a diagnostic tool. But the most important now is CBNet. Remember the full form of the CBNet. I'm speaking, I am not just written over here. Cartridge based, try to remember this, cartridge based nucleic acid amplification test. So you will remember with the help of this photograph cartridge. This is called cartridge. This blue color cartridge is there. What we are finding? We are using nucleic acid. We are using nucleic acid, amplifying it in this test. So it is cartridge-based nucleic acid amplification test. Remember this, I will ask later on. So another name for this is gene expert. You can read in the machine. This is CBNet machine. So another is gene expert. It is using nucleic acid. So it is using the gene of the bacteria to identify whether the mycobacteria is present in sputum or not. And these are different for 1, 2, 3, and 4. These are different 4 channels. These are the 4 sites. So simultaneously 4 sputums. In this machine, 4 sputums can be simultaneously examined. And it is connected with the computer. It is having the program which is linked with the computer. So it will detect the nucleic acid of this. It is amplification in the computer. It will take about 2 hours to run one session. In one session, 4 sputums can be simultaneously examined. So 4 cartridge inside this. We have to open this door. Like here it is on in one case. The door is open. We have to open the door and we have to put the container, that is cartridge, inside it. This cartridge is containing sputum. A sample of the sputum is taken into this cartridge, and it will take about 2 hours to run one session. In 2 hours, 4 session can be run in this machine. There are the machine which is having the 8 as well as 16, 8 and 16 channels also. So it can simultaneously run 8 or 16 sample. Advantage is that even if the small amount of the mycobacteria are present, it can diagnose easily. So it is having the higher sensitivity than this sputum microscopy, CBNet, cartridge-based nucleic acid amplification test. As well as another advantage is that it can also diagnose drug resistance. Currently rifampicin resistance can be diagnosed with this machine. So diagnostic algorithm for pulmonary tuberculosis is COP for 3, not 3, it is 2 weeks or more. This was old, and 2 sputum smears are taken. If one or 2 sputum are positive, 1 or 2 are positive, label this patient is having the sputum smear positive tuberculosis and start the anti-TB treatment. If 2 are negative, and patient can be put on the other antibiotic for 10 to 14 days. If the cough subsides, it is okay. If the cough persists, repeat this 2 sputum examination. If they are positive, 1 or 2 is positive, even after this antibiotic therapy, the sputum positive TB and start the anti-TB treatment. If 1 is positive, then X-ray. Nowadays, if 1 is positive, then patient is labeled as sputum positive. Previously, if 1 was positive, then X-ray, and X-ray is positive, then also sputum negative pulmonary TB was. Then treatment is same. Even if the patient is sputum positive, negative, treatment is same. That is algorithm. So diagnosis, as we have discussed, microscopy. So we know that in case of the extrapulmonary tuberculosis, 15% cases are of extrapulmonary tuberculosis. Suppose the TB of the meninges is there, covering of the brain. So in case of the TB meningitis, CSF is used as the treatment option. I mean to say diagnostic option. Bone marrow and liver biopsy in case of the miliary tuberculosis. In case of tuberculosis, abscess pus is used as the sample. In case of the renal TB, urine is used as the sample. So depending upon which is the site of infection of the tuberculosis, in case of the extrapulmonary TB, depending upon that, the samples can be used for diagnosis. Now about treatment. Anti-TB drug. So it includes 2 classes of the drug, bactericidal and bacteriostatic. So bactericidal include isoniazid, rifampicin, streptomycin. It is available as injection, pyrazinamide. And short forms, remember this short form: isoniazid H, rifampicin R, streptomycin S, and pyrazinamide Z. Here in case of the isoniazide and pyrazinamide, first letter is not used for the short form. So isoniazide, even it is not containing the H in their name, H is the standard short form this for this iso or code for this isoniazide. Pyrazinamide Z, and bacteriostatic is ethambutol. What do you mean by bactericidal and bacteriostatic? Write down in chat box. What do you mean by bactericidal and bacteriostatic? What do you mean by bactericidal and bacteriostatic? Write down in chat box. Write down in chat box. What do you mean by bactericidal and bacteriostatic? Have you heard this word in microbiology? Bactericidal and bacteriostatic. Have you heard this word? Bactericidal and bacteriostatic. Bacteriostatic means to stop replication. Okay, bactericidal is to kill bacteria. Very good. So bactericidal is to kill the bacteria, and bacteriostatic is to inhibit the bacterial growth. So that is the difference. And remember the name of the drug. There are some second line drug or reserve drug we can call thiacetazone, capreomycin, kanamycin, ethionamide, cyclosporin, and fluoroquinolone. You can remember this drug if you repeatedly read this name of the drug. You can easily remember. So these are the first line drug. These are second line drug. So that is a treatment strategy, short course treatment strategy, and long course. So previously the treatment of the tuberculosis was for 18 months. 18 months. Now with the use of the more drug since many years, since many decades, 2-3 decades, the 6-month strategy. So in tuberculosis, patient has to take the drug for 6 months. INH is isoniazide. You can call it as a salt as H also. Rifampicin, pyrazinamide. I'm going to show that is according to category. And this is the box, color-coded box of the treatment of this or pack of this anti-tubercular drug. So advantage of the short course chemotherapy, even if it is 6 months, it is considered as the short course because previously it was 18 months. So advantage of the short course chemotherapy are rapid bacteriological conversion, means patient become rapidly sputum negative, lower failure rates, reduction in the frequency of emergence of the drug resistance. So because of this combination of the drug therapy we are using, so drug resistant bacilli will also, frequency of this drug resistance bacilli will also decrease, lower failure rate, higher success rate, in other words we can say higher rapid bacteriological conversion, patient become rapidly sputum negative, and disadvantage is high cost, but we can overcome this disadvantage because it is given free of cost in our government hospital under RNTCP, or nowadays we can call it NTEP, that is National Tuberculosis Elimination Program. Previously it was RNTCP. Just 1 year before, the name of the program has changed. That is, not 1 year, just 6 months before, the name of the program has changed. That is NTEP, National Tuberculosis Elimination Program. So that is DOTS, as we know, under RNTCP there is directly observed treatment short course therapy. As we know that under the DOTS, 1 dose of the drug patient has to take in front of the healthcare provider, and patient will be given the other strip for the week. Previously there was thrice weekly treatment, and this thrice weekly treatment, on Monday patient has to take the drug in front of the healthcare provider, and 2 strips were the dose for 2 days were given to the patient, which is to be taken at the home. Patient will, on next week, patient will return this empty packs of the drug which he has taken, and patient will be giving the next dose. So again on second week also, on Monday, patient has to take, every week patient has to take drug in front of the healthcare provider on the first dose, and 2 doses will be given to be taken at the home. So that is directly observed treatment strategy. But nowadays, with the help of the 19N dots, this is 19N dots. So the patient is given the whole packet of the drugs to him, and there is one number which is written below this wrapper, below the wrapper. And at the time of the giving this drug, patient's mobile number is registered into the computer. So patient has to give the missed call. Patient has to dial, not missed call. Patient has to dial this number after taking the drug, so it can be ensured that patient has taken the drug. If the patient, if computer do not receive any call on one particular day, then the healthcare provider will realize that this patient has not taken today's dose, and this healthcare provider who is assigned to him, that is called STS, Senior Treatment Supervisor, he will make the call to the patient that why patient has not taken the drug, what is the reason. Try to explain him, he will give the insurance that the patient has to. So that is 19N dots. Why it is 19N? Because with this method we can ensure that 99% there are chance that patient will take the drug. And there are 2 categories in classification of the drug, that is category 1 previously patient, previously ill, extrapulmonary patient. Try to remember the category. Previously there are 4 categories, but these are the revised categories. Okay, the revised category, only category 1 and 2, and this category 1 there are new smear sputum positive patient, seriously ill sputum negative. Remember, sputum negative are also there in this category, so the treatment for the sputum positive and sputum negative will be same, and seriously ill extrapulmonary. So regimen for this is for 6 months. Total duration is 6 months. 2-month intensive phase and 4-month continuation phase. Now, so this figure indicate months. 2 months intensive phase, 4-month continuation phase. For 2 months, patient has to take HRZE, that is isoniazid, rifampicin, pyrazinamide, and ethambutol. Followed by 4 months, patient has to take HR, that is isoniazid and rifampicin. These 3 indicate thrice weekly regimen, means in week 3 days only patient has to take. Then this category 2 include sputum positive relapse, when patient has taken the treatment, completed the treatment, but again patient has relapsed with the tuberculosis. So sputum positive relapse, failure patient, sputum positive failure, treatment failure, and sputum positive treatment after default, when patient has left the treatment, again patient comes for the treatment. So relapse, failure, and treatment after default are included in category 2. It is for 8 months. As the patient has relapsed, as the treatment has failed, as the treatment default is there, so it is for longer duration, 8 months. 2 months HRZES, here streptomycin injection is included. Remember this, 2 HRZES. It is similar to this, but S is included. Followed by 1 month of the HRZE, and followed by 5 months of the HRE. H is for isoniazid, R for rifampicin, Z is pyrazinamide, E is for ethambutol, and S is for streptomycin. We will again revise next time this thing so that you can easily remember. 19N dots, you already know about this. So tuberculosis during pregnancy, we will just take for 5 minutes, and then we will end. So during pregnancy, isoniazid, rifampicin, and pyrazinamide are safe to be used. Streptomycin can cause permanent deafness in the baby, so ethambutol should be used instead of the S. Second-line drugs such as chloroquinolone, ethionamide, and these are teratogenic, so it not be used. So remember this only: isoniazid, rifampicin, pyrazinamide. These are safe in pregnancy. Childhood tuberculosis means tuberculosis present during the child age. So it represents the 10 to 20% of the all cases. Source of the infection here in childhood can be adult, usually the family member whose sputum smear is positive. So commonest age group in childhood tuberculosis is 1 to 4 years, because there is less immune system developed, and younger age is also at the risk factor for the disseminated tuberculosis. So commonly 1 to 4 year age, but whenever at the younger child it develops, it will develop disseminated, means widespread tuberculosis. Most children are sputum smear negative and not infectious to other. So that is about childhood tuberculosis. In case of the sputum negative TB, as we know that category 1 is used, but here the dose is given according to the weight of the child. No need to go into the detail now. Rehabilitation, another part we will take next time. So write down the full form of CBNet. We have discussed about CBNet. What is full form of CBNet? That is the diagnostic tool for tuberculosis, CBNet. Write down its full form. Yes, I am getting reply. Cartridge-based nucleic acid amplification test, CBNet. Okay, so advantage of this test is it is having the higher sensitivity, as well as it can also diagnose the resistant rifampicin resistance. So remember this category as well as diagnostic tools we have discussed. I will summarize just for between 1 to 2 minutes. Meanwhile, you write down your roll number in chat box. You write down your roll number in chat box. I will summarize the topic. We have discussed about different diagnostic tools, sputum examination, that is sputum for AFB. Then we have discussed about CBNet, that is cartridge-based nucleic acid amplification test. We have discussed about culture, LJ media, Lowenstein-Jensen media, as well as Bactet. Meanwhile, I summarize, write down your roll number in chat box. Then we have also seen about the treatment protocol when you suspect the patient for more than 2-week cough, chest pain, and hemoptysis, evening rash fever, loss of weight. Then we have also seen that after this investigation, what are the category 1 and category 2, what are the names of the drug, bactericidal and bacteriostatic drugs. So, some of the students are entering now. I have seen that entering now. At the time of writing roll number, it will not be allowed. I can realize everything. So we have seen this bactericidal and bacteriostatic drug. Next time onwards, I will be asking you 2 to 3 times to write down the roll number. We have different systems. If you are smarter, we are also smarter. So we have seen bactericidal and bacteriostatic, isoniazid, rifampicin, then this pyrazinamide, streptomycin, ethambutol, and we have seen 19 endorse. So this is what we have discussed about today's class. We will have some revision next time, and we will take next topic in next class. I think all of you have written your roll number. Okay, thank you.